Hey there, Dr. Anthony Llewellyn, the Career Doctor here. Today I want to talk to you about the concept of entrustability and how you can use this really effective concept to market yourself much more effectively in the doctor job application and interview process. So firstly, what is entrustability? Well, entrustability, according to the Oxford Dictionary, is an act where we assign responsibility for doing something or put that something under someone else's care or protection. So in medicine, the way this normally plays out is that a senior doctor who has the capability and the competency in a certain area of medicine or a procedure or other sort of action or activity assigns to a less senior, a junior doctor, so typically a consultant to say a registrar, assigns responsibility for performing a significant activity in terms of medical care. And they only do that when they have determined that that more junior doctor is capable of doing it, i.e. they trust them to do this now. So another way to think about this is, what are the key important things that you are trusted to do by your seniors? So if you're a resident, what does the registrar let you do independently? If you're a registrar, what does your consultant let you do independently? And even if you're a consultant, what other activities in the hospital or health service are you being given to do that are requiring more capability or creativity, etc., in terms of some of the problems and challenges that you're facing in your hospital or health service that more senior management or heads of department are allocating to you to do. And these are therefore your entrustabilities. So an example from a surgical trainee we've got here. Surgical trainees are obviously learning to become surgeons, and so some of the tasks that they need to be able to accomplish are demonstrating that they can perform the various activities related to surgery. So key tasks that a surgical registrar might be entrusted to do by a consultant is put together an operating list. Think about that. The consultant is not going to let you do that on their behalf unless they know that you can do that well, and that involves a lot of things like knowing which patient to put first, second, third. What do you do with a patient who has diabetes, for example? What are the times for operations? How much operating time have you got available? What are the particular consultant preferences? Equipment, that sort of stuff. Secondly, as a surgical trainee, you're obviously learning to perform operations. So what are the key, most difficult operations you can currently perform independently? And how many times have you done them now? Finally, a key role that most trainee doctors have to do in the hospital is perform what's called a consult, which is where another specialty team asks you to review a patient under their care and provide advice from your specialty's perspective into improving the care for that patient. So typically you'll take that referral, go and see the patient, assess them, provide some initial advice, and then bring your consultant back later to review what you've done. So again, consultants are not going to let you do that if they don't think you're capable of it, because that is, affecting their reputation and as well. So they want to know that you're able to do that and that they can trust you to do that activity well. So think about these peak activities in your current work experience that show that you're on a upward trajectory, if you like. A way I often describe this with my coaching clients is the mountain concept. So at the top of the mountain here is our entrustabilities, the most significant, serious, risky, complicated things that we're currently entrusted to do by someone more senior in our hospital or healthcare setting. So talk about them. Don't talk about the things that sort of sit underneath them, because that's wasting time. And the panel will actually assume that if, for example, you can do a consult, that you can also admit a patient, okay? So they don't need to know that stuff. All the stuff underneath, they will assume you're capable of doing by virtue of the fact that you're talking about a high level entrustability or capability. So a final example here from a resident medical officer. Now, resident medical officers are often trying to progress to specialty trainees, i.e. registrar roles. So think about what competencies as an RMO, if that's you, that you're demonstrating that show high entrustability. This might be the fact that you've had some opportunities already to perform consults, which is a key role of a registrar, or maybe you've done some of the procedures that the registrars are required to do. Then talk about them if you're trusted to do those. Think about the activities you do in the hospital that require the most from you in terms of independence and responsibility. So that might be the night shifts. So how many have you done of them successfully, and what key activities have you done on those night shifts, such as attending medical emergency team calls. And then finally, think about your professional development as well as terms of your entrustability. You know, what courses have you done recently that again showing that showing your peak in terms of your ability and capability. Okay, so in this example I've listed a couple of emergency type courses, and clearly this RMO is thinking about perhaps progressing towards a critical care role in, say, emergency ICU or anesthesia. So finally, where should you use this concept of entrustability? Well, use it pretty much in every stage of the job application and interview process. Use it in your cover letter. When you introduce yourself to the job panel, talk about the biggest attributes that you bring to the post, and then insert some of these entrustabilities. Use it in your resume. Plenty of opportunity in your personal summary to talk about your key entrustabilities currently in medicine. And then finally, when you get that typical opening question, which is, you know, what are your strengths, or tell us about you as a candidate, talk about some of your clinical and other capabilities that you want to outline to the panel that, again, show that you're at the peak of your performance and can provide the best value to them as a job candidate. So that is the concept of entrustability and how you can use it successfully to smartly market yourself in the job or the doctor job application and interview process. Plenty of other help on my blog, advancedmed.com.au, as well as services, courses, coaching, document support, etc., etc. And I will see you in the next video. Bye for now.